So people generally suggest that implants get changed every 10 to 15 years, and the reason behind that is while the silicone is generally a very safe and inert substance, eventually if you leave it in for a long time, all implants fail, whether it's a knee replacement or a breast implant. And so that capsule that contains that silicone will rupture, silicone will leak into the body's capsule that it's walled off, and so the idea is to try and change the implant before that. If it does rupture, it's not a dangerous situation, but eventually some of the body's little white cells will take some of the silicone to your armpit, and if a lady presents with an armpit swollen lymph node, then we always get concerned about breast cancer, which can then lead to further investigations which you otherwise wouldn't need. So the idea is to try and change the implant before it ruptures. That operation's pretty straightforward if everything else is set up nicely. Simply an incision into the capsule, remove the old implant, put a new one in. So that needs to the implant doesn't last forever. If you get pregnant after the operation, then you're going to have different changes to your breast. So sometimes you might need a lift afterwards if the breast falls off the implant.